Today, we're diving into a process that happens inside our bodies. It's silent, it's sudden, and you know what? It's incredibly common. We're going to break down the anatomy of a deadly internal blockage. Let's get right into it.
So just to set the stage here, get a load of this number. More than half, that's right, more than 50% of all deaths trace back to this one single process. We're talking about the big ones we all fear, major heart attacks and the most devastating strokes.
So that immediately makes you wonder, right? What exactly is this process? What is this silent killer that's at work inside so many of us?
Well, to really understand it, we've got to define the battlefield. We need to look at what happens when a critical supply line inside our body gets cut off, just like that.
The official name for this is infarction. And really, you can just think of an infarct as a dead zone. It's an area of ischemic necrosis, which is just a fancy way of saying tissue death, that's the necrosis, caused by a lack of blood flow, the ischemia. It's a brutal, simple equation. No blood means no oxygen, and without oxygen, cells die. It's really that straightforward.
And this is not some obscure thing you only read about in medical textbooks. Nope, infarction is the direct cause of a myocardial infarction, which you probably know better as a heart attack. It's the engine behind most strokes, and it's the same nasty culprit in those tragic cases of gangrene that can affect people's limbs.
Okay, so if infarction is the end result, what's causing it? What is creating these catastrophic roadblocks inside our arteries and veins? Let's meet the usual suspects.
Well, this chart makes it pretty clear, doesn't it? In a staggering 99% of cases, the blockage is caused by a rogue blood clot. This could be a thrombus, that's a clot that forms right on the spot, or an embolus, which is some kind of material that breaks off from somewhere else, travels through your bloodstream, and then bam, gets stuck.
So what about that other little 1%? Well, in very rare cases, an infarct can be caused by a severe spasm in an artery, or maybe a tumor pressing on a vessel from the outside, or even a traumatic injury that ruptures an artery. But as you can see from the numbers, these are definitely the exceptions, not the rule.
Now here's where things get interesting. The crime scene of an infarct doesn't always look the same. The way the dead tissue appears actually depends on where in the body the blockage happens. This gives us two really distinct types. On one hand, you have white or pale infarcts. These happen in really solid, dense organs, like your heart or your kidneys. Think of it like a cul-de-sac. When the main road in gets blocked, the tissue is so dense that not much blood can seep in from anywhere else, so it just becomes pale. On the other hand, you have red or hemorrhagic infarcts. These happen in looser tissues, like the lungs. In this case, even with a main road blocked, some blood can still kind of pool in the area, keeping it looking red and bloody. This also happens in tissues that have a dual blood supply. You know, where one road is blocked, but there's a side street that still lets a little traffic leak through.
So once that blockage is locked in place and the tissue is just starving for oxygen, a very predictable chain of events kicks off. Let's walk through the step-by-step progression of how that tissue actually decays.
It pretty much happens in 3 stages. First, the cells die through something called coagulative necrosis. The basic shape of the tissue stays there for a little while, but it gets all firm and pale. Then, within just a few hours, the body's cleanup crew shows up. Inflammation kicks in right at the edges of that dead zone. And finally, over time, the body does its best to repair the damage, usually by replacing all that useful, functional tissue with a simple, non-functional scar.
But hold on, the brain plays by its own rules. In the central nervous system, it's a totally different process. Instead of the tissue getting firm, it goes through liquefactive necrosis. The dead brain tissue is literally digested by its own enzymes and turns into a thick, viscous liquid. It's a pretty wild and destructive process.
And there's one more curveball to think about. If that thing that caused the blockage, the embolus, was carrying bacteria, maybe from an infected heart valve or something, that bacteria can then set up shop in the dead tissue. This is what we call a septic infarct. And it basically turns that dead zone into a pus-filled abscess. So now you have a dangerous infection on top of the original injury.
So this brings us to the biggest, most critical question of all. We know these blockages happen, but why is it that one person can have a small one and be totally fine, while for another person it's fatal? Well, the outcome really boils down to 4 key survival factors.
Okay, factor number 1, and this is the big one, the anatomy of your plumbing. Does the area that got hit have a backup blood supply? Some organs, like our lungs and liver, have dual circulations, which makes them super resilient. But then you have the kidney and the spleen. They have what are called end arterial supplies. It's literally one road in, one road out. You block that road, there's no detour. Infarction is pretty much guaranteed.
Factor number 2, speed matters a lot. If a blockage develops really slowly, over months or even years, it gives the body a fighting chance to adapt. It can actually grow tiny new blood vessels to go around the blockage. It's a process called collateral circulation. It's like building its own detours. A sudden, complete blockage, it gives you zero time to prepare, which makes it way, way more dangerous.
Third, not all our tissues are created equal when it comes to being starved of oxygen. Our brain's neurons are incredibly sensitive. They can be irreversibly damaged in just 3 to 4 minutes. Heart muscle cells, they're a bit tougher. They can last for about 20 to 30 minutes. And this is exactly why time is so critical during a stroke or heart attack. You are literally in a race against the clock for that specific tissue.
And finally, the quality of your blood itself plays a huge role. If someone is already anemic or cyanotic, which just means their blood is already low on oxygen for other reasons, even a small blockage that might not do much harm in a healthy person could be enough to tip the scales and cause a massive infarct. Their system just has no wiggle room, no margin for error.
So when you put it all together, you see this picture of a body that's both incredibly resilient, right, with all these built-in backup plans, but it's also incredibly fragile, where your survival can come down to a matter of minutes or millimeters. And that leaves us with one final thought. Our bodies have these backup plans, for sure, but in the face of our modern world, are they always enough?